Hi, everyone. My name is Scott McGann, and I'm your health agent giving you a weekly update on COVID-19. Um, Being the 27th, right now we have about 18 known cases of COVID-19, and those are the tests that have come back positive. It doesn't include the asymptomatic, those showing no symptoms. It doesn't include mild illnesses that someone may not have sought medical attention, or even doesn't, if a doctor's diagnosed it but not inherently done any testing. So the number's invariably a bit higher than that. And it will continue to increase for a couple reasons, partly because of spread, especially among family members, even if they are in quarantine. It's tricky to sort of stay away from somebody who might be a patient. Secondly, also the increase in testing. So the more we test, the more we find. The VNA, who works, has a contract with the health department and with the town, are continuing to track these, isolating all known cases and on quarantining close contacts. It's an imperfect science. It relies on an interview with the case to see where those close contacts come from, above and beyond sort of the immediate family. They are working all days, all night, tracking these, as myself, trying to isolate and quarantine and contain each case. As of today, the fire department, speaking with the fire chief, that we've been doing okay with the calls. The volume is not excessive, and they've been able to handle the volume of calls that they've been getting. The main thing I want to say today is to continue to be dedicated with social distancing, minimizing trips to the store, grab what you need for the week or so or more. Lots of frequent trips in and out. The more we mix with people, obviously, the more the risk is. It's definitely transmitted by the community at this point. There's no two ways about it. Hand washing, hand sanitizer, maintaining social distancing and meeting in small groups, all the stuff that you're probably pretty familiar with by now, needs to be maintained. I don't know when the end of that is. We're probably more towards the beginning of it than we are the end of it. I'm not quite sure at this point how long we would continue to do it. There's different theories out there. But it's just important to continue and maintain it, maintain our focus with social distancing. It's definitely helped. I could assure you that number that we just mentioned before would be higher if we were continuing to do things business as usual. The less interactions, the more chance the virus has to spread. So I'm sure there's been a benefit to it. It's hard to calculate that, but I'm sure what we've been doing has been helping, and hopefully it helps greatly. One other thing I meant that Dr. Fauci from the National Institute of Health had mentioned, people that are traveling from areas of high infection, such as the Metro New York, we've asked to self-quarantine for 14 days upon arrival. Obviously, we don't want to take areas from high infections to areas of low infection. So that's been a request, that anybody who's moved in from a high infection area self-quarantine for 14 days. Recently, you saw that Governor Baker issued a closing of non-essential businesses, and I'm sure that's impacted a lot of business owners. The week prior, I also sent out for nail salons and hair salons and the like. Now they're closed by the governor. I did that a couple days earlier, but that's posted on our site of which businesses are essential and which ones aren't. At the end of that declaration, there is a way to send an email to the state to request that they are, if you think you are essential. But the closing of non-essential is just to keep people from intermixing. And so that is posted on our website. And also, we've beefed up our website. We've been working hard on getting everything we can on our website. I'm going to request that this be put on the website. So the most up-to-date information should be on there. I'm doing a daily sort of recap or every other day recap. So check out our website if you need some more information. The fire chief, police chief, the town manager, myself, school department, we've been meeting at least once a week, up to 3 times a week, just to discuss how things are going with everybody. And that's going to continue. We just got off a call this morning. So we'll be continuing to do that. The call volume at the health department is heavy. We're here to answer as much questions as we can, as best we can. We'll continue to do so. I don't profess to have all the answers. Unfortunately, no, I don't think anyone does. But our volume this week was really centered around the Governor Baker's non-essential and what essential is essential. Don't call the health department if you've got issues with health. I think if you've got a medical issue, you need to contact your physician and/or the hospital. That's what I'm going to tell you, or somebody in my department would be telling you anyway. So that's my update for the week, and we plan on doing this once a week. Thank you.